Thank you, chairpersons. I totally agree with you. When I got Dr. Shah's mail saying you have to speak on this topic, and I'm a teacher, along being a clinician, I teach FNB, IFS, ESAR, all candidates. I just thought I should not refuse this because I know nothing about it. And I agree with Anita because she set the ball rolling for me. At least now you know a little bit about gut dysbiosis. However, I'll bring to you can you see it? Okay. The relation between vaginal or gut dysbiosis and infertility. So remember, I'm going to connect two things. One is the vaginal flora and the gut. So, introduction to dysbiosis. This is the status from where I started to prepare my talk. I wanted to know what is dysbiosis. And since the birth of the first IVF baby in 1978, artificial assisted reproductive technology has become safer, more successful, and accessible with increasing demand. However, some women are unable to become pregnant or experience a pregnancy. And hence, a new perspective on fertility is emerging as a result of increasing knowledge about the microbiome and its role in reproductive health. Dysbiosis, the first word I needed to understand for myself was it is an imbalance between the types of microbes. Good and bad microbes are there, and it is a balance between them or an imbalance in a person's natural microflora which form their microbiome. So what is microbiome now? In cell numbers, imagine what is microbiome. It is 3 times the human cells we have. And in the amount of proteins it codes, it is 360 times higher proteins which are coded by these microbiomes compared to the genetic structure we have in our body. And then there are 5 distinct microbiomes according to body sites: oral cavity, nasal cavity, skin, GI tract, vagina, and gastrointestinal tract. So I'm going to talk on gut microbiota, has the most dense and diverse microbial community, and the other one is healthy vagina is dominated by lactobacillus species. This is all I could think that you could remember as gynecologists, as clinicians who are treating PCOS. So let us look how does it contribute to obesity and insulin resistance. So we'll go categorically: obesity, PCOS, endometriosis, and then we'll see how it connects to infertility so beautifully. Good influencers are short chain fatty acids which are derived from fermentation. So here I catch Anita Soni, fermented food. So derived from fermentation of gut microbiota, have anti-inflammatory effect and improve insulin sensitivity. Bile acids regulate glucose metabolism and improve insulin sensitivity. And branch chain amino acids such as leucine, isoleucine, valine can also regulate metabolism of glucose and lipids. Gut dysbiosis results in decline of all the above 3. And what comes up? The bad influenza. And which is the bad influenza? Lipopolysaccharides. You just heard her say the holes become big. Lipopolysaccharides from food just leak into the circulation. And that is where the inflammation starts. So this is a diagrammatic representation. And this is the lipopolysaccharide, the negative regulator. Seen there? All the others are positive regulators of the gut. We move on to relationship between gut dysbiosis and PCOS. So here I told you about obesity. How does one get obese because of gut dysbiosis? Now there is a different mechanism in addition to obesity, what it has with PCOS. Possible relationships which have been sort of studied, contemplated between gut dysbiosis and PCOS are obesity or high fat, low fiber diet. This is the mantra of having everything imbalanced. Having everything balanced. So you go on the reverse side and everything imbalances. So the moment you go wrong on the diet, the moment you go on to fast food, it increases gut permeability or it causes a leaky gut. The holes become big and it starts leaking. What does it leak? It leaks the lipopolysaccharides. which should not have leaked. Once they go into circulation, the inflammatory changes start. Activation of the immune system interferes with insulin receptor function, and therefore hyperinsulinemia increases, which in turn increases ovarian androgens, causing anovulation. Another thing which happens is that it causes PCOS directly also. It decreases the secretion of gut-brain peptides. There is a direct relationship of these peptides with the brain from the gut, which are these serotonin, ghrelin, and peptide YY, which have a role in regulation of appetite. Once this goes haywire, you're always hungry, you always want to eat. Whether you say it is acidity or it is something else, comes to your mind that you want to eat, and it also leads to direct hyperandrogenemia contributing to PCOS. So here you see a diagram, you see number 1, 2, and 3. 1 is where the leaky gut, lipopolysaccharides into the circulation, inflammatory changes, the whole series of function leading to hyperandrogenemia. Second is direct indication to the brain, where the hunger pangs increase. And the last is it can directly influence androgen levels and thus increase or aggravate underlying PCOS. A PCOS girl, till she is, say she weighs 50s, in her 50s or early 60s, she still has regular cycles. She has a lot of symptoms which are under control. But the moment she tips over that ideal weight, everything comes into 4. So this is with endometriosis. Very interestingly, I read there were 2 mechanisms which led to endometriosis. We all understand that when there is a pro-inflammatory response in the peritoneal cavity, the anti-inflammatory response reduces and there is pro-inflammation. So whatever comes to the peritoneal cavity is not cleared out. It keeps sticking there, causing inflammation. So there is disruption of normal immune function, which leads to elevation of pro-inflammatory cytokine, compromised immunosurveillance, and altered immune cell profiles. Apart, it also leads to one more thing. That is, it increases the level of circulating estrogens, and hence proliferation of all these endometriotic implants, and thus endometriosis can also be caused by a leaky gut. So this is how it happens. This is the healthy part of the gut where there is an absolute balance between the good and bad, and on the other side, endometriosis starts when the balance gets disrupted. Now we come to the relationship between gut and the lower genital tract, that is vagina. So how close are these two organs situated? Why would not the gut microflora affect the vagina? And the gut is the richest in the microflora. So genital tract infections, for them, rectum is the key reservoir for vaginal lactobacilli. Rectal colonization with these microorganisms contribute to the maintenance of healthy vaginal microbiota. There is a strong evidence that both of these are connected, and once the lactobacillus supplied from the rectum becomes less, there would be naturally a vaginal dysbiosis. So gut dysbiosis and fertility. So I've finished the part of gut. What happens to the fertility part? Ovarian dysfunction, PCOS, aggravation, endometriosis, disruption of menstrual and ovulatory cycle, which will affect fertilization, embryo development, genital tract infections, and lead to adverse IVF outcomes. So for all IVF specialists, don't think that this is the only cause. It is the laboratory which leads to more adverse IVF outcomes. And in pregnancy, we all know what vaginal infections do. I think the main cause of preterm birth is bacterial vaginosis. We all understand that. So we all are afraid of bacterial vaginosis. This is one reason for which we do an internal every visit after 12 weeks for our antenatal patients, because this is the high-risk group which gets pregnant after IVF. This is the same thing which I just told you. It disrupts the menstrual cycle, the formation of gametes, ovarian dysfunction, leads to poor fertilization, and then if the lady gets pregnant, then a lot of events which are unwanted even happen in pregnancy. Now I come to the second part, which is vaginal microbiota. The superhero bacteria in the vagina is the lactobacilli, which protects our vagina by making its environment inhospitable for potential villain pathogens. So this is a very important statement because we all want lactobacillus in the vagina to keep it healthy before pregnancy, during pregnancy, and after pregnancy. Mainly, lactobacillus is important because of its ability to synthesize lactic acid from vaginal epithelial cells by anaerobic fermentation. Thus, it becomes acidic. The acidic pH makes the vaginal environment unsuitable for other pathogens to grow, and lifestyle, hormones, reproductive ages, this all shapes how the vaginal environment is going to be. Even serum estradiol concentration is important. So this is a small pictorial depiction of what happens with lifestyle, geographical localization, racial, genetic factors, and estrogen, of course. And also the partner's semen microbiota affects this. So a word about bacterial vaginosis. You can see the lactobacillus dominated vagina and the Gardnerella dominated vagina. A dysbiotic vaginal microbiome is loss of lactobacillus dominance and rise of anaerobic bacteria. Bacterial vaginosis is the most frequent vaginal dysbiosis, which affects almost 20% of women. And what happens? A film forms over the vaginal epithelium, and hence every time the pathogens keep on growing, and we just cannot have the lactobacillus to dominate there. And up to 40% of these women may be absolutely non-symptomatic, and yet they may have adverse pregnancy outcomes. Diagnosis can be done by Nugent's scoring, Amsel's criteria, or the newer diagnostic techniques like NGS and PCR. However, this is important that vaginal dysbiosis and fertility is affected by increasing sexually transmitted bacteria, and it can also lead to male reproductive tract dysbiosis affecting sperm parameters. So both these factors sort of increase the incidence of infertility. IVF also, it is the same. The lack of consensus on its role comes from the lack of common criteria to cross-check data, small sample size, lack of data due to novelty of the field. This is a new field. In fact, in human trials came up in 2012 for the first time. So the association, this was the whole study which I could find in Pathogens 2021, where a total of 17 studies on humans were included, comprising of 3,500 patients with vaginal dysbiosis. And I would just bring you to the gist of this, that significant reduction in the clinical pregnancy rate when compared to normal vaginal microbiota patients, but it did not influence the live birth rate. The quality of evidence was very low across all outcomes, and thus more studies are warranted. So the last word is very few studies have been done. It's a new topic, something so new that we come on this dais today and call out for help because we had to read it for the first time. Antibiotic treatment, there are two standard things which have to be given, either metronidazole with clindamycin or it is tinidazole with clindamycin. So these are the two standard antibiotics to treat orally or vaginally. And prophylactic antibiotic before embryo transfer is not advocated. It has nothing to prove that it would help, so it is not recommended. Last of all, one word about what Anita was telling us, probiotics, prebiotics, and synbiotics. Probiotics are what we give as medicinal things to our patients. Prebiotics are food stuff which is not absorbed by our small gut, the upper small gut. It goes right till the end and sort of influences the good bacteria growth. And synbiotic is a combination of both. So these can be used, and we all understand that there are oral and vaginal probiotics which have been developed to restore healthy vaginal microbiota. Lactobacillus supplementation is becoming very popular now. There is a consensus on the efficacy of vaginal probiotic used in addition to the antibiotic therapy. and even prolonged use of these probiotics can probably prevent the vaginal infections from coming back again and again. So I come to the last slide of mine, the reproductive microbiome clinical practice recommendations for fertility specialists. All infertility patients must be asked for clinical symptoms, which means a smell, discharge, and UTI. And this is such a good question to ask, that ask the patient, does she, while she changes her undergarments, does she have an odor which she thinks is not her normal body odor? Is there a different odor? And if it is, then there is the wrong bacteria which are growing in the vagina. No symptoms, no further testing recommended in clinical practice. Vaginal dysbiosis can be measured in multiple ways, but there is no gold standard present. The best is just to make a wet smear or the smell. Limited evidence on whether uterocervical colonization should be routinely assessed. Antibiotics should not be used on a routine basis to change vaginal typology. So it could be probiotics, but not antibiotics. And the last is preconception counseling is useful, as again we come back to the same thing, lifestyle changes. It can impact reproductive outcomes, possibly by modulation of the vaginal microbiota. Therefore, weight loss, physical activity, lifestyle changes should be discussed and encouraged in infertile patients, especially those that affect nutrition, leading to beneficial changes in the gastrointestinal microbes. Thank you very much.